Hello, my name is Dr.Srikanth V. I am a practicing plastic and cosmetic surgeon. I practice at Manipal Hospital, Bangalore and at Clinic Bangalore, which is also at Bangalore. Chin augmentation. Chin augmentation basically is a procedure wherein the chin gets more defined after surgery. Now, some people are born with a slightly receded chin or a not so prominent chin, or they may feel that the face is not fully balanced because the chin does not define very well in them. Such patients benefit with chin augmentation. Now, chin augmentation can be done in very many ways. You can either slide the bone forward, which is known as a sliding genioplasty. We can add the bone there, wherein a bone graft is taken from the hip and put on the chin. Or if you do not want any of these kind of bony work done, you can augment it using artificial material, that is a prosthetic material either made of silicone or some other implant, made of polypropylene. So many implants are available in the market. All these are placed surgically, and once it gets integrated into the face, your chin will look more and more prominent. Sometimes if you do come in for a consultation for rhinoplasty, if your plastic surgeon feels that there is not adequate balance between the nose and the chin, he may suggest that along with the rhinoplasty, that is the nose job that you get done, you can go in for a chin augmentation. In some people, the side of the jaw doesn't get well defined and they come in asking for a chin augmentation, whereas what they will benefit is with a very fine liposuction of the jawline to give a well defined, strong jawline. These are the different kinds of chin and jaw augmentation that one can go in for. So it is good for you to know about these things and go and discuss with your plastic surgeon what is it that you will benefit from, and then you can decide if you want the procedure done. This chin augmentation usually are done as a daycare procedure. That means you come in the morning, you get operated, and by evening when you recover, you can go. Following surgery, you can expect some amount of swelling of the face. The swelling of the face is very unpredictable. Some people have very minimal swelling, some people have a lot of swelling, but these are all temporary, and over a period of time, that is 2 to 4 weeks, this swelling dissipates completely and you can enjoy your new profile.